Namaskaram, welcome to my channel BPK Nutrition, Mind Body Healing with Pushpa. February is American Heart Month. So in today's episode, I'm going to be talking about high blood pressure or hypertension, which is a big cause of heart disease. So I'm going to be sharing some diet tips, both from a modern perspective as well as an Ayurvedic perspective. So stay tuned to find out more. Welcome back, everyone. First of all, I would like to say thank you for watching me with all these episodes. And if you haven't already done so, please do subscribe to my channel and also share with friends and family who can learn a lot about self-healing by watching some of my videos. So let's get started. First of all, hypertension is a major cause of heart disease. It can, if it left uncontrolled for a long period of time, it can also lead to kidney disease. And a lot of my patients with kidney disease have had blood pressure for a long time or diabetes. So it's very important that we try to control it right in the beginning so you don't end up with more complications later on in life. Now, according to Ayurveda, hypertension is predominantly a pitta problem. Again, pitta, if for those who don't know, you can go learn more in detail about all the body types. But again, just to give you an idea, pitta person is one who is like a type A person, always driven and passionate and doing a lot of things, very intense in their approach to life, both physically and mentally. And a lot of times they end up forgetting to eat when they're working really hard and pushing themselves, that this leads to further stress, and the stress and the emotional aspect of pitta increases their blood pressure as well. Now, again, that doesn't mean that other doshas like vata, which is generally hyperactivity, cannot lead to hypertension. It can. If vata is involved, then the blood pressure tends to be more erratic in nature, high and low. And when the kapha, which is inertia in the body, is involved, then their blood pressure tends to be high all the time. And these are the people who are more overweight or obese. And so for them, losing weight can be helpful. For a vata person, focusing on lifestyle may be helpful. Now, blood pressure itself should be approached from a holistic standpoint rather than just looking at diet alone. So you need a three-pronged approach of diet, lifestyle, and yoga and pranayama. So I've split up this topic into three parts. Today I will be covering part one, talking about all the diet tips based on modern nutrition and Ayurveda. Part two will talk about lifestyle and activities, and then part three will cover yoga and pranayama specific for blood pressure. So stay tuned and let's get started. First of all, I'm going to talk about the modern approach to diet, which is basically the DASH diet. So let me go through that. Again, I'm going to be using my emoji to talk about all of the dietary aspects. The DASH diet consists mainly of whole grains, fruits and vegetables, less amount of meat, like fish, poultry, any kind of meat, and then low-fat dairy or non-fat dairy, less fats, as well as nuts and seeds, and no sweets. So let me show you some of the portion sizes that are recommended. 7 to 8 servings of grains, 4 to 5 servings of fruits, 4 to 5 servings of vegetables, 2 to 3 servings of low-fat or no-fat dairy products, meat, fish, and poultry, 2 ounces or less per day, plant-based protein, nut seeds, and dry beans, 4 to 5 servings per week, sweets less than 5 times a week, and of course, fats and oils, 2 to 3 servings per day. As you can see, modern nutrition, the DASH diet, gives a broad classification of all the food groups and tells you how much to eat from every group. However, it is not very specific about the vegetables and fruits that could be beneficial for blood pressure. And this is where Ayurveda fills the gap, giving you the tastes of food and helps you pick out the right vegetables that would help you further. And I'm going to talk about those next. Now let us look at Ayurvedic nutrition perspective for the control of blood pressure. I have classified into 3 categories. 1 is some general guidelines. 2, what are the foods to include in your diet? And 3, what are some foods to avoid? Number 1, general guidelines. 3 things to keep in mind. Now, first of all, do not skip meals. Eat something nourishing. If you don't have time, at least eat some fruits till you have time to eat. Second thing, make sure you eat a lunch as your heavy meal or the main meal of the day. And third, keep your hydration level good by drinking enough water. 6 to 8 cups is very beneficial. Number 2, what foods to include? First of all, the taste would be sweet, bitter, and astringent taste. Sweet doesn't mean dessert, but more complex carbohydrates. Again, choose whole grains and also like rice, wheat, brown rice, and also things like quinoa, millet, oats, etc. Now, vegetables and fruits, you should pick only those that are in season. Vegetables that you can choose are dark green leafy vegetables, carrots, beets, sweet potatoes, some squashes, zucchini, cucumber, any of those water vegetables that are cooling and hydrating for pitta. Fruits, again, choose them in season. Sweet fruits like berries, mangoes, again, only in summertime, pomegranate, which is astringent, grapes, and amla, which is an Indian gooseberry, is excellent for pitta management. And then melons like watermelon and cantaloupe may be good, especially in the summertime, not during the winter months. Dairy products include a couple of servings of milk and a little bit of ghee with every meal for better digestion. It also has butyric acid, which is good for the gut microbiome. Protein. Now, Ayurveda does not recommend too much animal protein and prefers a more plant-based approach for better health and well-being because we digest that better. So choose more dry beans and peas and lentils for the protein and the fiber. But if you do eat meat, choose milder options like freshwater fish or chicken without the skin, etc. Spices are a big part of Ayurveda for better digestion. Although pungent taste can increase pitta, use some cooling and warming spices like coriander, a little bit of cumin, cardamom, black pepper sparingly, turmeric, a bitter spice, and also some fresh ginger. Lime and lemon juice can also give added flavor on a low sodium diet. Last category, oils and fats. So make sure you choose healthy fats like avocados, almonds, walnuts, pecans, etc. And olive oil is good or seed oils are okay, but avoid the refined oils like vegetable oils and canola oil. Beverages, besides water, it's okay to have some pomegranate juice, amla juice, which is gooseberry juice, aloe vera juice, beet juice, and also some herbal teas like hibiscus tea or peppermint tea. Number 3, what are the foods to limit? Now, limit salty, sour, and pungent taste. Limit fatty foods and high-fat foods or fried foods and processed foods. Dairy products, limit cheeses and yogurts, sour cream. Anything that is fermented can increase pitta. So kombucha, kimchi, and these are other things that can raise pitta. Fruits, avoid sour fruits like citrus fruits, not lemon and lime, but the others, pineapple, and also raw mangoes, and eat them very small quantities. Again, this should depend on where you live and what kind of season you're going through. When it comes to meat, again, limit high-fat meats, red meats, and also salty meats or lunch meats like salami, ham, and also tuna, etc. Spices, limit very heating spices like ajwain, rosemary, cayenne pepper, and cinnamon that can raise your pitta and blood pressure eventually. In beverages, again, limit caffeine, tea, coffee, etc. Try more herbal teas, and then limit alcohol and colas, sodas like the Coke and Pepsi, etc. Hope you enjoyed today's episode. Now, to give you a quick recap, I talked about a diet from a modern perspective, which is a DASH diet, an Ayurvedic diet based on what foods to eat and what not to eat, and also some guidelines. If you want to remember even one thing out of all of this from an Ayurvedic point of view, it's much easier because people remember taste. So focus more on choosing sweet, bitter, and astringent taste, and limit salty, sour, and pungent taste. Now again, you can learn more details about taste from my 6 taste video, and I will share the link in the description. Stay tuned for next week. Again, I'll talk more about lifestyle and activities, stress management and sleep. And then the third week, I'm going to be talking about yoga and pranayama. So join me again next week and have a wonderful week ahead. That's all for today, folks. Have a wonderful week ahead. Listen to your body, observe your mind, and help yourself. And join me next week.